In the early stages of ancient Greek medicine, diseases were seen as a form of divine retribution and recovery was deemed a blessing bestowed by the deities. Nonetheless, around the 5th century BCE, there was a shift towards seeking physical rather than spiritual reasons for illnesses, marking the beginning of a journey from superstition to scientific exploration. Despite this shift, the realms of the spiritual and the scientific remained intertwined. Medical practitioners of the time started focusing more on the human body, investigating the links between symptoms and diseases, and evaluating the effectiveness of various treatments. It's important to note that Greek medicine was not monolithic. It varied widely in terms of methods and beliefs, influenced by a range of factors including geographic location, time period, local customs, as well as the patient's gender and social status. A key theme in Greek medical philosophy was the emphasis on the impact of diet and the empowering belief that patients had the agency to improve their condition, moving away from a previous resignation to fate. Yet, in Greek medicine, the lines between the mystical and the material often overlapped. Take the god Asclepius, for instance, who was revered not only as a deity of healing but also as an adept physician. Devotees would seek guidance through dream incubation at his sanctuaries, hoping for divine advice on their ailments, which the temple healers would interpret and act upon. The thanksgiving offerings left by healed worshippers, depicting a variety of ailments such as blindness, parasitic infections, physical disabilities, snake bites, and speech disorders, serve as a window into the health issues addressed by ancient Greek medical practices. As shown by the example of Epidaurus, it's evident that ancient societies recognized both divine intervention and natural causes or treatments for diseases. It was understood that lifestyle choices, along with environmental factors like temperature changes and physical injuries, played significant roles in a person's health, potentially easing or aggravating symptoms or the diseases themselves. Additionally, the inherent physical makeup of an individual could influence how severely they experienced or how susceptible they were to certain diseases. A deeper insight into the reasons behind disease symptoms was believed to be crucial in combating the disease itself. As knowledge of human anatomy expanded, so did the belief in the significance of maintaining a balance of bodily fluids in preventing illness. Observing and understanding the nuances of symptoms also became a key focus for Greek physicians. The earliest recorded discussions on Greek medical practices are found in Homer's Iliad, where battlefield injuries, such as Patroclus treating Eurypylus' wound with warm water, are described. Greek literature, including comedies, frequently references medical issues and physicians. The most comprehensive information, however, derives from about 60 medical texts traditionally linked to Hippocrates, antiquity's most renowned physician. Despite that, it's challenging to definitively attribute any of these texts to Hippocrates or to confidently detail his life. These Hippocratic writings encompass a wide range of medical concerns, categorically focusing on diagnosis, biology, treatment, and professional guidance for practitioners. Additionally, fragments of texts from Greek natural philosophy, dating back to the 6th to 5th century BCE, serve as another resource. Philosophers, recognizing the impact of physical health on the mind and spirit, often addressed issues related to the human body in medicine, whether directly or indirectly. Among these intellectual giants were Plato, Empedocles from Acragas, Philistion from Locri, and Anaxagoras. The esteemed Hippocratic Oath, often linked to a select circle of ancient physicians, was in essence a religious pledge that bound the doctor to community norms and ethics. This oath invoked deities like Apollo, Hygiea, and Panacea, committing the physician to honor their mentors, refrain from administering poison or mistreating patients, avoid surgical procedures, and uphold patient-doctor confidentiality. Noteworthy figures in medicine from the 4th century BC included Diocles of Carystus, Praxagoras from the island of Kos, and Athenians Mnesothius and Ducas. These medical pioneers had the skill to diagnose ailments just by looking at a patient's face, taking into account factors such as diet, bowel habits, appetite, and sleep patterns. Their remedies often harnessed the power of nature, utilizing herbs and roots, as well as amulets and charms for healing. Surgeons of the time typically avoided risky procedures, opting for surgery only in cases of dire necessity, such as treating battlefield injuries. Doctors found treating soldiers an effective means to expand their medical expertise and deepen their understanding of human anatomy and physiology. The battlefield presented a lower risk of repercussions should a procedure go awry, compared to treating civilians. Beyond common ailments like malnutrition, dehydration, hypothermia, fevers, and typhoid that affected both soldiers and civilians, military medics faced unique challenges such as treating cuts and punctures from swords, spears, javelins, arrows, and other projectiles. They recognized the critical steps of extracting foreign objects from wounds, thoroughly cleaning injuries, and promptly stopping bleeding to prevent hemorrhage. Surgical procedures of the time might have incorporated opium as a pain reliever, but given the frequent literary accounts of patients being restrained during operations, it seems that anesthesia was seldom used. After surgery, to close wounds, practitioners used stitches made from flax or linen, followed by dressing the wound with linen wraps or sponges that could be moistened with water, wine, oil, or vinegar. Additionally, leaves, egg white, or honey might have been applied to aid in sealing and healing the wound. Attention was also given to post-surgical care, including diet and the use of anti-inflammatory plants such as celery to aid recovery. Gradually, physicians gained a rudimentary understanding of human anatomy, a knowledge likely deepened by inspecting battle injuries and, from the 4th century BCE, by dissecting animals. Yet, this practice was not without controversy. Some argued it was futile because they believed exposure to air and light altered the body's internals, while others opposed it on ethical grounds, deeming it cruel. The exploration of human anatomy through dissection awaited the Hellenistic period, which led to significant discoveries like the complete nervous system. The pursuit of knowledge began to shift towards understanding the mechanics of a healthy body rather than diagnosing issues in an ailing one. This inexperience, however, led to critical misunderstandings, like Aristotle's assertion that the heart, not the brain, governed the body, or the claim in the treatise on ancient medicine that physical discomfort is caused by the body's inability to digest certain foods. Despite its errors and possibly deadly mistakes, the medical practices of the Greeks laid the groundwork for the modern medical profession, steering it towards future advancements. Observation, experimentation, and lived experience allowed successors of the Hellenistic and Roman eras, like Galen and Celsus, to advance their investigations on the path to a deeper and more precise understanding of human anatomy, the diseases it can face, and the possible treatments. And so our journey through the world of ancient Greek medicine comes to an end. They may not have gotten everything right, but the ancient Greeks set a course for the heart of the physician's role: diagnosis, observation, and aiming for the root of the problem rather than treating just the symptoms. Through their explorations, they birthed the idea of balance, both in our bodies and in our lives, setting the first stones on the path to holistic health. Their collective approach, which included diet, lifestyle, and environment as critical factors in health, is a perspective that continues to be embraced in modern times. Their unquenchable thirst for knowledge has ignited the same in us, a flame that pushes us to pursue and push the boundaries of modern medicine. For all their errors and mistakes, the ancient Greeks were pioneers who dared to step out of shadowy superstition into a world of scientific exploration. That's all for today's episode of our History of Medicine series. I hope you found it as fascinating as we did. If you enjoyed this deep dive and want to continue with us on our journey through time and discovery, remember to like, comment, and subscribe to our channel.